WBUR Podcast, Boston.
I'm Daryl C. Murphy, and you're listening to The Common. Priyanka Dayal McCluskey, WBUR Senior Health Reporter. Welcome back to The Common.
Thank you.
So I guess we're going to talk about what could be some good news, maybe? I don't know. I guess we'll get into it.
We'll get into it.
The COVID state of emergency is ending tomorrow, May 11th. What does that mean?
It's definitely a significant point in this pandemic that has been going on for over 3 years now. I wouldn't say it's necessarily a moment to celebrate, given how many people have been sick, how many people have died from COVID.
Mm-hmm.
I'm not really hearing a celebratory tone, but it's definitely a turning point in this COVID era that we're living in.
Let's talk about what would make this a turning point. The first thing that comes to mind for me is the masking. I don't see as many masks as I have before, right?
Yeah, so masking is definitely one of the things that is changing, that the policy that requires people to wear masks in healthcare facilities like doctors' offices and hospitals, that statewide policy is ending, among other policies that are changing tomorrow. And what that means is it's going to be optional to wear a mask in many healthcare facilities now, some of the biggest hospitals in the state.
Is that for visitors, or does that also include staff? Staff no longer have to wear masks either.
It's for everyone. The policies vary a little bit from one provider to the next, but this is applying to staff, patients, and visitors.
Oh, man. How are people taking that?
There's a range of feelings about this. I think a lot of people have gotten used to wearing masks all the time in healthcare facilities, and many of them are going to continue doing that because they feel safer doing that for themselves and for the people around them. Other people are ready to show their whole faces, and they're looking forward to that. So I think it really varies depending on who you're talking to and the circumstances.
Another big thing I'm thinking about is the testing. What's going on with that?
Yeah, this is going to be a really visible change, and it's one that some public health experts are concerned about. Getting a COVID test is going to be more expensive for most people. Now, if you're sick and you get a test ordered by a doctor, that will still be covered by an insurer. But what's changing is those over-the-counter rapid antigen tests that many of us have taken at home, maybe after a gathering or before seeing a loved one, or to check if, are these cold symptoms a cold or are they COVID? Those have been covered by health insurers, but that rule that requires health insurers to provide these tests is also ending on Thursday. So, that means people will have to pay out of pocket if they want these tests. If you have a private health plan, you'll have to pay out of pocket, most likely. If you're on Medicaid or Mass Health, then those tests will still be provided for free.
And how much do those tests typically cost?
Yeah, it's about $12 a test or $24 for a 2-pack. And health insurers have been providing up to 8 free tests per person per month. So it's, if you want to pay for that yourself, it's going to be almost $100.
Yeah. $12 to $24 doesn't seem like a lot of money for a lot of people, but you got to think about people who may not be able to afford that. But also, if you can, that can add up over time, right?
Yeah, it can add up over time, particularly because we often need more than one test, right? Like if you're checking if you are developing COVID, you might need to take a few different tests over several days to really rule out or to detect that infection. If you have a household with multiple people in it, you might need multiple tests as well. So when you are concerned about COVID, it's easy to go through a whole bunch of tests. And I'm saying that from personal experience.
Yeah. I guess how important is testing right now? Because the cases seem like they're much lower than they've been, right? What role is testing playing at this current moment? Do they just feel like we're not using the COVID tests as much as before or something? Like, what's going on there?
Yeah, that's a great point because the cases, number of COVID infections, hospitalizations, deaths, all of these numbers are lower than they have been in the past, and that's a good thing. But there's still concern that if you're asking people to pay for tests now, is that going to discourage people from taking a test when it might be a helpful thing? And so is that going to delay detecting infections? Is that going to potentially delay people getting treatment? Because if you do have COVID and you're eligible for treatment like Paxlovid, you need to take that within a certain amount of time of your symptoms developing. So time does matter when you have a COVID infection for yourself personally to get treated, but also having that information so that it informs who else you're seeing or whether you stay home or go out into the world. So there are a lot of potential, impacts of less testing.
Okay. You mentioned Paxlovid. Tell me about COVID treatments. Will those still be covered by insurance?
So treatments like Paxlovid and vaccines are still going to be covered by insurance.
Okay. And then let's get into the vaccines. Can people still go to their CVS and get vaccinated for COVID for free, or will they have to pay for those as well?
It should be free for people to get their vaccine. One thing that's changing, though, is the mandate to be vaccinated if you are a state worker, for example, or a city worker.
Mm-hmm.
And so, as we know, Governor Charlie Baker at the time implemented a vaccination mandate for Massachusetts state workers, and Mayor Michelle Wu implemented a mandate for Boston employees. And these mandates have been really controversial, but they're actually ending as well on Thursday.
We're going to take a quick break, but we'll be right back.
Politics has never been stranger or more online, which is why the politics team at Wired is making a new show, Wired Politics Lab. It's all about how to navigate the endless stream of news and information and what to look out for. Each week on the show, we'll dig into far-right platforms, AI chatbots, influencer campaigns, and so much more. Wired Politics Lab launches Thursday, April 11th. Follow the show wherever you get your podcasts.
And we're back. So we got through vaccines, the mask. Big changes are happening, right? Some things are staying the same. But what if, when the fall comes around, weather gets cooler, more events indoors, more gatherings indoors, cases start to tick back up? Can all of this be reversed?
That's a great question. I think it remains to be seen. So state officials and healthcare leaders that I've been talking to say they're going to keep tracking COVID, see what happens with the numbers, and adjust policies if needed. But what's the threshold for making that change? It's not really clear. And some experts I've talked to say once you start to unwind these things, it's hard to bring them back.
Yeah.
So we'll really have to see. I think many people expect that COVID numbers will rise again in fall, in winter. So what level of increase is enough to change any of these policies? It's not clear yet, but it's possibly, we will see changes to masking, for example, if there's a lot of illness going around.
And I guess, is it fair to say that if the cases do go back up, we've been in this for more than 3 years, right? We can respond to it a lot better.
We have a lot more to respond with. We have the vaccines, we have treatments, we have tests, although they're, as we've talked about, becoming more expensive. And there's a lot more immunity in the population now from vaccines as well as people who've had previous infections. So we are in a different place than we were a year or 2 years ago.
Well, Priyanka, state of emergency is ending soon. People are still getting sick, though, right? It's still real out here for some folks. How should we be thinking about the pandemic now? Where should we stay vigilant?
Yeah, it's going to depend. Some people have really moved on a long time ago. They moved on from COVID and they're not really thinking about the pandemic every day.
Mm-hmm.
Other people don't really have that luxury. There are people who have medical conditions or other reasons why they are more vulnerable to be become sick if they get COVID. And I know many people are concerned about these changes and whether these changes may be putting elderly people or immunocompromised people at further risk. So, I'd say some people definitely have moved on and some just, they feel that they can't, and they have good medical reasons to feel that way.
Word. Okay, so as we approach the end of the state of emergency, a question that comes to mind is this still a pandemic?
So COVID is definitely still out there, though in smaller numbers than in the past. But, some people feel like we are now in the endemic stage that we have been waiting for. Others are not so eager to say pandemic over, but we're definitely in a different stage of COVID than we've been in the past.
Priyanka, thank you so much for taking the time to talk with us and guide us through what looks to be the next phase of the pandemic, So thank you very much.
Thank you, Daryl.
That's WBUR senior health reporter Priyanka Dayal McCluskey. And that's our show for today. Thank you so much for listening to The Common. If you have any thoughts on this episode, we would love to hear from you because we want to know what you're thinking about the pandemic at this point. Is it over for you or are you just going to mask until forever? I don't know. Hit us up on Instagram at WBUR The Common or send us an email at thecommon@wbur.org. I'm Daryl C. Murphy, and I'll talk to you tomorrow.